Did you know that your household income will affect how much you'll pay for Medicare Parts B and D? In this video, I'll discuss how Social Security calculates what you pay for your Medicare benefits and how you can file appeal to have those premiums lowered. Be sure to stay to the end for the specific forms you'll need to file that reconsideration request or appeal. While most people on Medicare pay nothing for their Part A hospital benefits, they do pay for their Part B outpatient benefits. Every year, Medicare sets the Part B premiums for all Medicare beneficiaries. This amount climbs over time slowly due to the ordinary healthcare inflation that we have here in America. And in 2023, most new enrollees pay $164.90 a month for Part B. However, about 7% of beneficiaries pay more because they earn more, and Medicare calls this an income-related monthly adjustment amount, or IRMAA for short. So how much more will you pay? Well, that will be determined by the Social Security Administration, and here is how they do it. Each fall, the IRS sends your tax return information from 2 years ago over to the Social Security office. And the folks at Social Security will review your modified adjusted household gross income, or MAGI. Again, this is usually your tax return from 2 years prior to the current year, or in other words, there is a 2-year look back. Now, I'm sure you're wondering what types of income are included in the modified adjusted gross income. Your modified adjusted gross income is generally the total of your household adjusted gross income plus any tax-exempt interest income you may have earned. At the time we are filming this video, your adjusted gross income amount can be found on line 11, and any tax-exempt interest income can be found on line 2A of your IRS Form 1040. Not everyone will have tax-exempt interest income, so for most of you, your modified adjusted gross income will be the same as your adjusted gross income found on line 11. The types of income that will be included are wages that you've earned, dividends you receive from investments, pension income, rental income, capital gains, property sales, and even your non-taxable Social Security income. People in the highest bracket can pay over $560 a month for their Part B premiums. It's important to also mention that if you have a higher premium for Part B due to higher income, you'll also incur a higher premium for Part D. You'll pay your Part D plan's regular premium, and then Social Security will tack on a monthly adjustment on top of that. You can find a current version of this income chart for both Parts B and D, along with a handy calculator to review your costs on our website, boomerbenefits.com. The link is in the notes below this video. When looking at the income chart, you can probably see why this would be important to estimate accurately before you retire. It might be hard to make ends meet, or you might have wished that you worked for another year or two to save up more money for your future healthcare expenses. The good news is that Social Security pulls your tax return data annually and automatically adjusts your Part B premium for the next year based on those numbers. So if you had a blip year where your income was unusually higher than usual, your Medicare premiums will likely only be affected for that 1 year. As soon as they see on the next tax return that your income went back down, Social Security will automatically adjust your Part B premium back down as well. They will mail out a new benefit determination letter to you in the mail every year, usually in December, to let you know the premiums they have calculated for the next year. Now, here's the best part. You don't always have to wait for Social Security to review your information each year. If there is an accepted, valid reason why your income is now lower than it was 2 years ago, you can file a request for reconsideration with Social Security and ask them to review the information and potentially lower your premiums sooner. Some of the qualifying reasons that they'll accept to reconsider your premiums are income changes due to marriage, divorce, or death of a spouse, the loss of an income-producing property or pension income, and of course, just plain old retirement. when your income was higher while you were working, and now of course it's less because you've retired. So how do you file a request for reconsideration? Here are the steps that you should follow. View and download the form SSA-44 on our website. We will link it for you below. Then complete the entire form identifying the reason why your income is now lower than it was before. You'll estimate your true modified adjusted gross income for the coming year. And finally, you'll enclose any documentation that you may have to show the validity of your claim, including a copy of your most recent tax return. For example, if your income is lower now because you retired last year, you might include copies of your last pay stubs and a letter signed by your former employer saying that you retired on a certain day. Social Security will review your information and let you know by mail, usually within about 60 days, if they approve your request to have that premium lowered. While there are no guarantees, we've had many clients successfully get their Part B and D premiums lowered by filing an appeal in this manner. It's free to file a request with Social Security, so what do you have to lose? Download the form today and request a reconsideration if you have one of those acceptable qualifying reasons. It might just save you hundreds or even thousands of dollars in premiums over the next 2 years. Do you have a question about what Medicare costs or how much your Medicare Part B premiums will be? Be sure to type it in the comments below and we'll be happy to answer for you. Thanks for watching, and we'll see you in the next video.